Good evening all and welcome to this evening's Cadlam Cymru revision sessions. This session will focus on AS Psychology and will be delivered by Miss Bellis from Allen School up in Flintshire. All recordings are saved and uploaded onto the e-sgol website, so you can access them at any point before your examinations. The question and answer section is available if you have any questions that you would like to pose during the session, and we'll endeavour to answer them as promptly as possible. Diolch yn fawr, thank you so much, Miss. Over to you.
Thank you. Hi everyone, and welcome back to this AS Psychology session. So far in these sessions we have looked at the therapies, and today we're going to carry on doing that. We've looked at drug therapy and dream analysis, CBT and systematic desensitisation, and today I'm going to focus on just one therapy, the last therapy, which is mindfulness. And then after that, I am going to talk to you about a little bit of exam technique and some revision technique as well. Okay, so again, like I have said in each of these sessions, we need to study one type of therapy. It's a form of treatment that the approach believes is the most effective. And some centres will have chosen different therapies, but today we are going to be looking at mindfulness therapy. They are always your higher marked questions between 10 and 12, and you can be asked to describe and evaluate the therapy, so we need to know both of those things. Using examples is really, really important when gaining marks, and I'm going to talk you through how you can embed some examples into your answer today. And then, like always, terminology is really important in order to move up that mark band. One thing that is quite important to note is that as of now, and we are currently the 7th of February 2023, we have got the advance information for the 2023 summer exam series. If you're watching this video after 2023, then what I'm about to say may not apply to you, so just be aware that this is the summer exam series 2023. Now, for the positive approach, which is where we are today, mindfulness and the evaluation and description of mindfulness is on the advance information, which means that it will be a focus in the exam. It has been named as something that may possibly be there. So that means it's really, really important and should be, along with everything else, a focus of your revision. But like I have said, I'll repeat myself again, that is this year, so 2023 exam series. So really important, no matter what year you're sitting the exam, to make sure you know the therapies, but it may be just that little bit more important this year that mindfulness is answered correctly. All right, so first thing we need to do is apply our assumptions of the positive approach to the therapy. Now, there are, like always, 3 assumptions that we need to know and apply. The first of the assumptions is authenticity of goodness and excellence. And this is when we look at our core character strengths and virtues, as well as our psychological well-being. Now, there is a questionnaire, quite an interesting questionnaire that can be completed, and I would really advise you to complete the questionnaire, as it will just further your understanding of this assumption. So if you were to search VIA character strengths questionnaire or VIA signature strengths questionnaire, either of those, you can complete a questionnaire that asks you lots and lots of different multiple choice answers, questions about yourself, and you answer how best they suit you. And then what happens is you get a ranking of 24 core character strengths. So they are your 24 best strengths of your person, of your personality. And normally they focus on the top 5. So they are things like love, humility, love of learning, humour. And there's lots of different core character strengths and virtues. And mindfulness works on those character strengths. It allows you to understand your character strengths and then embed them into every day so that you have a positive outlook on life. So I definitely would recommend completing that questionnaire. I think it'd be really helpful. Mindfulness aims to enhance a person's positive characteristics. So once you know that you know your character strengths and you know what your sort of top strengths are as a person, you can then use them in everyday life. So if you know that your top strength is optimism, for example, like it says here, then you can go through life or go through your days knowing that you are optimistic. And normally, if you think that you are something, you tend to actually be it. So if you think, oh, optimism is my top character strength, in your day, you would actually find that you are more optimistic. And that's how it works to increase your happiness. And they say that this helps with acceptance-based methods. It allows you to accept your feelings because you know your strengths even more and that you've got key terms to explain how you feel. So that's your first assumption and how it links to this therapy. And then second one, second assumption of the positive approach is the acknowledgement of free will. Now, unlike all of the other approaches, positive approach is all about free will. It is not deterministic, okay? It doesn't say that our behaviour is determined by things that are outside of our control. It's all to do with free will. We have the choice to do something. And central to practicing the art of mindfulness is becoming consciously aware of your own present thoughts and feelings, and that is free will. You need to be present of your thoughts and feelings so that you can control them and you're able to self-regulate them and you're able to bring your attention back to how you're feeling or back to your breathing. And that is acknowledging that we have got free will. It's also, this is quite a nice point to bring into a comparison question as well, isn't it? Because unlike all the other approaches, this one focuses quite a lot on free will. The free will-based therapy is in line with the positive approach. We take control of our feelings and it's central to increasing life satisfaction and contentment. When we're in control of things, we are happier. Okay, that's the basis of this. Okay, next thing is to do with gaining control of thoughts. It's all to do with focusing on what you feel right now and making sure that you can sort of hone in on your thoughts and your emotions and how your body feels. So if I was to say, oh, think about how your little toe currently feels, all you can think about is how your little toe feels either in your shoe or in your slipper or sitting on the floor or sitting on a chair. Now, prior to me saying that, you're probably never even aware of your little toe and how it was feeling. And it's making sure that you can focus on your thoughts and bring the attention to different areas of your body. Mindfulness teaches us to become aware of all incoming thoughts and feelings and to accept them. So even though the focus in mindfulness is on your breath, and I'll talk more about that in a minute, if your mind does wander, let it, but slowly bring it back to your breath. Accept that you've got that feeling and then come back. The goal of focusing is to gain a greater awareness of unhelpful or negative thoughts that often dominate us in order to gain control over them. So allowing them, being aware of it and saying, yes, that is a negative thought. However, I'm not going to think about it right now. Instead, I'm going to focus on my breathing a little bit. We're able to gain control over them that way. Okay, so mindfulness is actually quite a common practice that lots of people do. It's not exclusive to psychology as a therapy. It's actually quite trendy now and lots of people use it on a day-to-day basis. There's lots of different ways that you can do it. It's really easy for you to download an app and have a look at some guided meditation. You can have a look on YouTube, and there's lots of videos of meditation music, or you can join meditation classes in front of you. It is definitely getting more and more awareness. And meditation and mindfulness is a bit of an art form. It's something that you have to practice and get better at. The first time you probably do it, it may be quite difficult, but after a few attempts, it definitely gets easier. So it says here, central to mindfulness is the art of meditation. And meditation is usually learned through a mixture of guided instruction and personal practice. So normally what happens is somebody will go with a mindfulness instructor, and they will sit in a group, or it could be one-to-one, and they will have a guided meditation. Now, this can be through having someone speak to you about areas of your body to focus on. So it could be a body scan. So, for example, focus on your toes, focus on your feet, focus on your ankles, focus on your calves, focus on your knees, and therefore you are being guided through it. Or it could be through personal practice. Now, normally with personal practice, this is something that once you've got the hang of it and you've had a little bit of guided instruction, you can then go on to do personal practice once you've mastered the art of it and once you're a bit more confident. Guided meditation involves getting the client to sit comfortably, keep the spine straight, and ask them to direct their attention to their breathing. Now, you can either sit up for mindfulness, or you can lie down on the floor. As long as your spine is straight and you are comfortable, then that's great. And it is directing you to your breath. Normally what they say is breathing through your nose and breathing in through your nose and out through your nose, normally for a count of 4 each time. And doing that and really thinking about your breath and thinking about your lungs expanding allows you to have more control over your thoughts and feelings. Then, after they do that, they are encouraged to start paying attention to their body sensations. So, like I said before, thinking about areas of the body that are touching the floor, possibly, or bringing attention to different body parts. It's a way of you, again, being in control of your thoughts and feelings. And it keeps your mind busy, okay? It's for, 15, 20 minutes, half an hour, an hour, that you don't think about negative thoughts because your body is relaxed and you're thinking about something else. So that alone prevents the intrusion of unhelpful negative thoughts because you're busy, your mind is distracted, it's focusing on parts of the body, it's also focusing on breathing and counting those breaths as well. Once you've got that practice, once you're able to do some mindfulness with instruction, and then you're able to do some mindfulness on your own as personal practice, mindfulness can actually be practiced throughout your everyday life. And it can be something that is brought into your routine every day, essentially. So you can have formal mindfulness practice, which is where you maybe go to a class and you sit with an instructor and other people and you are mindful together. Or you can have more informal mindfulness practice, which is almost the opposite of multitasking. It's making that conscious decision to focus on one single task. I'm going to take 10 minutes and I'm going to focus on one little thing. Informal practice simply involves paying attention to your surroundings, okay? And then there is an example on the screen. This is a bit of a silly example, but it's something that hopefully you will be able to understand and really get a grip of the kind of informal practice that I mean. So, for example, if you are in the shower, that is something that we do almost every day or every day. And it's noticing your body sensations as the water hits your skin. It's being aware of temperature changes from one room to another. It's not something that we do naturally. It's definitely something that we have to focus our mind onto. Things like listening to the sounds of falling water and so on. Being okay in terms of noticing different sounds, different feelings, And again, noticing how things feel when they're touching your skin. We never really are aware of them. Mindfulness wants us to pay attention to them. Okay, so a shower is just an example of how we can embed this into our everyday lives. Okay, mindfulness therapy is actually rooted in ancient Buddhist practice. So it actually has a very religious element to it, which links in quite nicely with Myers and Diner, which is your study for this approach, because that focuses on religion and culture being something that actually can improve somebody's well-being. Like also, another side note on top of that is that Myers and Diner is on the advanced information for the summer exam series of 2023. So it's quite nice that these two things link together and they are on that advanced information. It's a way of teaching somebody how to control their own mind. They pay attention to and increase awareness of their present thoughts. Although it's quite obvious, isn't it, mindfulness? I don't actually think it's a very difficult therapy to get your head around, especially in comparison to some of the other approaches and the therapies that they have. It's an antithesis of our mental habits. The mind is normally in autopilot. We don't really think about how we feel until we maybe stop doing something, or we focus on the past or the future, and things are very busy in our day-to-day lives. Mindfulness just wants you to slow down and think a little bit more about how you're feeling. Okie dokie. Okay, so the best way to understand this therapy is to have a go at it. Lots of the other therapies that we look at with the other approaches are therapies that you won't necessarily be able to do yourself. Mindfulness is something that absolutely you can have a go at. So on the slide at the minute, there are 7 main points that I would work through in order to have a go at mindfulness. First thing is settling into a comfortable, balanced seated position on a chair, on the floor, and the room needs to be quiet. Keep your spine straight and your eyes closed, and then bring your awareness to your body sensations and become aware of your body movements. So breathing and maybe the rise and fall of your chest and your abdomen. Think about how that moves, think about how that makes you feel. Maintain awareness as you breathe in and out from one breath to the next. And again, maybe breathe in for 4 counts and breathe out for 4 counts. Allow the breath to flow without trying to change or control it, and notice the sensations that go with every movement. This is the tricky one, number 6. As soon as you notice your mind wandering, bring back your awareness to the movement of your abdomen and do this over and over again. You may find that your mind just keeps wandering off, but as long as you have the power, the willpower, and the control to bring it back, even if it's just for a few seconds, over time, that will get easier. So it's very easy to maybe lie down and start thinking about controlling your breath, but then also think about everything you've got to do in that day, and maybe all of the homework or the revision, or if you've got a part-time job, or just a life admin, really, isn't it? So practice makes perfect with this one. And then the last point is you've got to be really patient with yourself. It will develop. You will get better at it as you go. And that's something that mindfulness therapy really, really tries to get people to do. Don't give up with it. Keep going. Okay, so in terms of mindfulness, that's it. It really is quite a brief therapy, and very different in the way that it is explained to you, especially from all of the other therapies. Like I said, they are usually our higher marked questions, and you can be asked to describe and evaluate them. We need to have examples, things like the shower. It's a form of example. And having appropriate terminology as well. So things like signature strengths, mindfulness, meditation, Buddhist, things like that. Like I have said previously, a glossary of key terms is really, really helpful, or creating mind maps and going back to check if you remembered everything and adding in missing information. They're really, really helpful ways of getting your head around this. Also, what I've got next on the next few slides are some other ways of splitting up your revision, I suppose, making your revision slightly easier. So splitting mindfulness therapy up to 3 sections and creating a table like this allows you to clearly see what the headings and what the content is split into, essentially. So coining control of your thoughts, so being able to have the free will to control your thoughts. The meditation and mindful breathing, so that would be how to do it, lying on the floor, being very still, closing your eyes, etc. And then there's different informal practices of mindfulness, and the fact that if we bring it into our everyday life, it's something that we could actually practice every day. Because there is research to state that, you know, mindfulness does have a positive impact on people's happiness and people's well-being. That's also a really important part of this. So I think if you were to split it into 3 sections when you are revising, that will help. Also, another way of revising is doing an identify, explain, how paragraph. And I do these sometimes with my pupils. Just identify one assumption, just being able to know which assumptions come under each heading. So, for example, it says the assumptions to dream analysis. So identifying one assumption would be maybe the psychosexual stages of development, explaining that assumption. So writing down in that box absolutely everything that you possibly know about that assumption. And then ask yourself, right, how does that link to dream therapy? How does what I just said link to what I know about dream therapy? And you can do this for all the different therapies. Identify the assumption, then give an explanation of the assumption, and then link it to what you know about the therapy. If you split it into those 3 sections, and if you first did it off of memory without looking at your notes and doing it now, and then doing it after you've had a look at your notes, you're really able to develop and build on what you already know, which is a really good, clear indication of what you then need to go and revise. For the therapy, I have split this one, this is the psychodynamic approach, into 4 sections. Dreams as wish fulfillment, which is to do with if we cannot dream and fulfill our dreams in our waking conscious life, they are relegated and we dream about them instead. The symbolic nature of dreams, so the fact that we have got latent and manifest content, and that is when our dreams, the meaning of our dreams is sort of pulled into more innocuous form, and we actually dream about something very, very strange, but it actually means something that's relevant to our lives. The process of dream work, so those 5 different key terms that you've got: representation, secondary elaboration, condensation, displacement. They are, you know, those are key terms that will be made up within that dream work process. And then lastly, role of the therapist. Role of the therapist is to reverse the dream work process and understand the meaning of the manifest content. Now, printing out tables like this and filling them in is really, really helpful because it means that you physically got the information down in front of you. One thing that lots of my pupils find really, really helpful is to have a table like this in front of them and actually just speak about it. So maybe talking to somebody else, having a few prompts on a piece of paper, so literally headings like there are on the screen now, and saying what you know, becoming the teacher and teaching somebody the content is a way of you having to understand it because you've got to explain it to somebody else. And then the behaviourist approach therapy, so systematic desensitisation, which I looked at last week. 3 elements of that as well that are really, really important. There are also 3 key terms that you need to know. So you've got the idea of counter conditioning, which is this idea of reciprocal inhibition, that you cannot have 2 contrasting emotions at the same time. And therefore, if you're taught to relax your muscles, it also means that you won't have that fear feeling, you won't have that anxiety and feeling of fear. And then desensitization therapy, which is the hierarchy, which you are ranking various different situations with your phobic object. And then different forms of SD. So you've got in vivo and in vitro. One of them is having the phobic object in front of you. One of them is just thinking about your phobic object. And again, it's writing down briefly in the columns what is helpful and what you know, but also talking about it as well, like I said previously. And then the cognitive approach, dysfunctional thought diary, writing down our thoughts, ranking them. How much do we believe they're going to come true? And then asking yourself, right, do I have any evidence of that? Do I think that somebody is talking about me behind my back? Is there any evidence of that? And then cognitive restructuring. What's the harm from that? Have you heard anything? Has anyone said anything to you? And it's being able to understand your own conditions so that you can respond effectively if you feel threatened. And pleasant activity scheduling, so making sure that you have at least one pleasant activity scheduled every day that you can look forward to and that you can use as sort of motivation to get through your day. Okay, so once you have sort of gone with these sheets here, and what I do have is a really big PowerPoint that I created that is full of things like this for every element of every approach. And when these PowerPoints get uploaded onto the website, I will also add that too, so that can be uploaded as well as a revision resource. What I'm going to do now is quickly go through with you 2 essays. Oh, I've got the same essay twice. That's fine. I will go through this one essay, which is describing the assumptions of the cognitive approach. And I want you to see if you think this is good, and we'll have a little look to see if we can improve it in any way. And then I'm going to talk to you about the best way to really get to that top mark band of evaluation questions. So let's have a read of this one then. So 2 assumptions of the cognitive approach. One of the assumptions of the cognitive approach is that of schemas. Schemas are packets of information that have been built up through media, stereotypes, and personal experiences. Schemas help us interpret information quickly. An example of a schema is that dogs have 4 legs and a tail, as well as the assumption that if you were in a car crash, you would assume that there was glass on the floor, whether there was or wasn't. Schemas can be a negative thing too. They're often the basis of a stereotype and can be incorrect. They can also cause us to misremember things because of the way we would assume it should have happened. Okay, so that's your first assumption. So let's walk through this then and see what we think. One of the assumptions of the cognitive approach is that of schemas. Sorted. Lovely. Being able to identify the assumption. So tick. Schemas are packets of information that have been built up through the media, stereotypes, and personal experiences. Nice. Little bit of detail added as to what schemas are. Schemas help us interpret information quickly. An example of a schema is a dog. Great, because we've got an example in here. They have 4 legs and a tail, as well as the assumption that if you're in a car crash, you would assume that there would be glass on the floor, whether there was or wasn't. This one, I know what they're alluding to. They're alluding to Loftus and Palmer, but I don't think the explanation is quite clear there of what the actual schema is and how it could influence our memory. So if I were them, I would have just stuck with this dog one because that's much clearer what they mean. Schemas can be a negative thing too. We're talking about sophisticated language here, aren't we? And thing doesn't sound very A-level standard, does it? They are often the basis of a stereotype and can be incorrect. Absolutely. Where's my example? Okay. They can also cause us to misremember things because of the way we would assumed it should have happened. Now that is quite ambiguous, isn't it? We don't know what that means. Where's the example here? So it starts off strong with an example and a really nice explanation, but actually we need a bit more explanation here. So schemas can be a negative thing too. They're often the basis of a stereotype and can be incorrect. For example, all criminals are male. That is a schema that we have. Or all burglars wear stripy white and black t-shirts. Okay, they are incorrect schemas. So I would definitely say a really good start and some quite nice detail, but lacking some examples to really further their explanation. Then we've got another assumption of the cognitive approach is the internal mental process. There's just a bit of a typo there. This assumes that we process information through attention, sound and smell, memory and perception, and problem solving. This assumption assumes that if one or more of these processes does not work properly, then there will be a mental issue present in the person. For example, anorexics often suffer from body dysmorphia, meaning they see their bodies differently from how others would. This can make them feel that they look bigger than they are, leading to an eating disorder. So the example is nice. The example is quite well explained, and I'm quite happy with that. The start of this is a little bit weak. This assumes that we process information through attention, sound and smell. That's a bit confused. I think we're talking about the multi-store model of memory here, and that we have sensory memory and that we can pay attention to it. So I actually think there's a bit of confusion between the assumptions here, because if it's talking about the internal mental processes, then memory, perception and problem solving are absolutely correct, but this start bit just seems a little bit muddled. And then it says this assumption assumes that if one or more of the processes does not work properly, then there will be a mental issue present in the person. Yeah, correct. And again, backed up with quite a nice example, but a little bit rusty here at the top. So if this was an 8-mark question, which normally assumption questions are, it would be 4 marks for this one and 4 marks for this one. And I would probably say that this would get maybe 4 or 5 out of 8, which would probably be around sort of the CB grade boundary. Purely for there is detail, however, the evidence are a little bit muddled up, and then that this bit is a little bit incorrect here. So I would probably go with 3 for this one and 2 for this one. Yeah, could be a 6 because they have got quite nice examples. But in order to get up to that top mark band, it's definitely needs to be a little bit more clear, a little bit more coherent, and we need to have some improved examples as well. Okay, what I'm going to do now for the last 10 minutes of this session is talk to you about something that I use quite regularly with my students, and this is a resource that can be used to really gain some deeper understanding of evaluation questions. Now, again, from the advanced information of the 2023 exam series, there is an evaluation of the whole approach for all 5 approaches on there. There is clearly a emphasis on evaluations and comparison questions. So, and also because they are higher marked questions, they are absolutely something that we need to get right. And this help sheet should allow you to think slightly outside of the box when it comes to evaluations. Now, it can look quite scary because there's lots of words and there's lots of columns, but actually if you break this down, it's a really simple resource to follow. Now, an acronym that we often use is GRENADE. Now, GRENADE down the side here looks at, well, you've got study evaluation and then you've got evaluation of approaches and theories. So if you're evaluating a study, the best way to think about it is GRAVE. Okay, they're not very happy words, are they? GRENADE and GRAVE, but again, really, really helpful. So they stand for generalizability, reliability, application, validity, and ethics. So asking yourself these questions. So if you're looking at a study, can we generalize these findings to different groups of people? So for example, if you're thinking about Loftus and Palmer's research, she used predominantly male college students from America. So can we actually generalize these findings to different groups of people? Not really. Okay, so there is a lack of generalizability. Reliability, can the research be replicated? Is there a way of somebody testing it? And again, it's different for every study, but a good question to sort of ask yourselves. Application, can the findings be applied to the real world? Are they helpful? Have they helped us? Is there a practical application? Okay, for Loftus and Palmer, absolutely. It helped us understand eyewitness testimony and how leading questions can influence somebody's perception of an event. So that has a really, really positive application. And then the V of GRAVE is validity. Does it measure what you think it's going to measure? Does it apply to the real world? Is there such thing as ecological validity? Was it done in a normal, natural setting? Again, another question to ask yourselves. Then we've got, lastly, the E is ethics. Were any ethical guidelines broken? But were these justified? Okay, so sometimes lots of the research is justified because it's really, really important that we learn about that behaviour. And then across the top then, this is our evaluation of our whole approach, but also of theories. So we've got GRENADE. And again, an acronym: gender bias, reductionism, ethics, nature versus nurture, animal studies, determinism and free will, and then Eurocentrism as well. And then these are just questions to work through. Is there a gender bias? How might the study not apply to both genders? What does this mean for the original theory? They're just questions to answer or discuss with another person. And due to sort of how sophisticated the questions are, it really does allow you to think about it slightly differently. What are the implications of the ethical issues? How could it hinder society? How does this affect a theory? For determinism, free will, is the theory too deterministic? Is it saying that we don't have any free will? And it's these sort of more sophisticated evaluation points that end up getting you those more higher mark bands. At the bottom is just a little bit of help with splitting up this exam. So you're tested on your AO1, AO2 and AO3 knowledge. So AO1 is facts and figures. So it's an outline of a theory. So that could be an assumptions question. It could possibly be a methodology question from a study. AO2 is applying your knowledge to a scenario question. Now, last year in the 2022 paper, there was a scenario question linking a therapy or a theory to a person. So there may be cases of applying your knowledge to a situation. And then you've got AO3, which is evaluate, analyse, judge and strengths and weaknesses, which is where you would use this help sheet, GRAVE and GRENADE. And then the last little box at the bottom is appeal paragraph. Point, introduce your point. What are you going to say? Okay. Bowlby's study has many ethical issues. It has ethical issues, meaning that evidence, it is unethical because there is a lack of confidentiality. link it back to the question. Lack of confidentiality means that we cannot assume that the study has been done in the correct way, which therefore means that there are issues with believing the results, etc. Following that procedure is a really clear way of getting those top mark bands. So there we go. That's my help sheet to help you get more out of an evaluation question. Okay, so 3 sessions that we have covered have now covered all of the therapies. And next week in the last session, I am going to cover more exam technique. So I can bring in this help sheet again, but also I'm going to go through some questions to see where great exam technique can be seen, but also so we can identify possible weaknesses with exam questions as well. I really hope that was helpful. Thank you very much, and I will see you next time. Diolch.